Okay, the next thing I want to talk about is allergy medications and how patients take them and some of the pitfalls that go along with them. There's two main allergy medications and categories that physicians prescribe. One is the steroid nasal spray, which does an amazing job of preventing some of the allergy symptoms. And again, we're talking about hay fever and allergic rhinitis. And the other major one is antihistamines. Often oral antihistamines are used to block the symptoms. The most common mistake I see happening with patients is they take the medication when they have symptoms as opposed to preventing symptoms. Because if I told you that the mechanism for all your symptoms involve the allergen binding to the IgE and then literally blowing up your mast cell and releasing histamine, once that histamine is released, you cannot put the toothpaste back in the tube. The histamine's there, and the medicines we are giving you are not going to get rid of that. So you have to understand that most allergy medications in the categories that we're talking about are preventative. I often hear patients and friends tell me, oh, hold on, I'm getting allergy symptoms. Let me go take my allergy medicines. That doesn't really work. That's going to prevent your exposure that you have 2-3 days from now from adding to what you're having. But it's not meant to, like Tylenol getting rid of a fever, it's not meant to get rid of your symptoms. And I can't tell you how many times I tell someone the same thing, and yet they're like, no, I'm just going to wait. And part of it is, I think, the psychological barrier to taking a medication when you're feeling fine. So imagine you feel perfect, but you're going to go to the medicine cabinet and take your allergy medicines. Us as humans, kind of the way we look at medication is, if I get the fever, I'll take the Tylenol. And if I get the itchy eyes and the runny nose, I'll take my allergy medicine. That's exactly how it doesn't work. Allergy medicines are one of the few medications that you have to take before you're exposed to the allergen. So if you're going to your Aunt Louise's house who's got 5 cats, and you're allergic to cats, you take the medication several hours before you go to your aunt's house, not after you've had dinner at your aunt's house, you're feeling horrible, let me take my allergy medicine. And same thing with seasons. If you know summers are going to be a challenge and you work outdoors and you're allergic to grass or whatever, so maybe right before the summer or in the spring, you start your medications and then stop them, when the winter rolls around. So depending on what you're allergic to and how you're going to be exposed to it. So that's why, like, if you talk to most allergists, they'll tell you the number one therapy for allergies is avoidance. Avoid it.